Guys, Dr. Brown here, and today I'll be introducing my new short series, emphasis on the short series I like to call So I'll give you a quick backstory as to how this idea even came to me. I can't forget, I had a patient, or I had a mother that was very concerned about the amount of drool that was coming out of her child's mouth. And she was just like, is this normal? Like, doc, like, is he ever gonna stop? And I said yes, because it was normal. And I realized because of her concern in her face, I said I kind of probably should do a little short series about just simple questions that patients may ask that we might think is a little silly, or we expect you to know, but you may not really know. So if you're interested in watching, keep on watching. So with that being said, I'll be talking about drooling in children specifically. Now, drooling, excess saliva, or in medicine as we like to call, hold on, let me get the pronunciation right, Cialoria, is basically when there is so much saliva that is dropping from the mouth. This is normal in children. It normally happens around ages 2 to 3 months, but on average age 3. And this is because children have not developed their swallow muscles, so it's going to drip. But normally, by around age 18 to 24 months, they would have gained full control of their swallow muscles and muscles in their mouth, so that wouldn't happen. But we say that anything after ages 4 is considered pathological. No. Pathological or abnormal, there are causes of it, right? So one of the causes I'm going to go into is, let's say, hypersecretion. Hypersecretion, or this excessive production of the saliva, can be due to inflammation. Inflammation can happen if a baby is teething at the time, or if there's an infection within the mouth that can cause the drooling. The next thing is going to be GERD or reflux. Basically, the stomach juices come up into the mouth and also induces excessive production of saliva. Another thing which is very common is in neurological conditions such as children who suffer from cerebral palsy or a mental, or I should say intellectual disability. And our last category will now be a structural problem. If it is that the child has a very large tongue, or if there's any bony abnormalities within the mouth itself, or if it is that the teeth alignment is different, it can then of course impair how the child is able to gain control of the saliva that's in the mouth and can cause the drooling. Just like anything in life, if there's anything excessive, it can be a concern. So the concern, I would say, is more physical now. So if your child is now having so much saliva that's just dripping from the mouth, what can happen is that the size of the mouth, for example, will have also moisture, and then no bacteria or any kind of organism can live there and cause infection. They will call it angulochlosis. Another thing can cause is chapping or maceration of the lips. We don't want that because a lot of ulcers and inflammation around the mouth too. And of course, if it is that your child is suffering from this, it can cause some psychological or psychosocial concerns because the child might be teased at school for it, or want to isolate themselves because they're being bullied. And even as, for example, the mother, she has this baby that's just drooling everywhere, drooling on her. She probably doesn't want to kiss the baby because it's just too much, which I think was the concern about my first patient. But don't worry, there are treatments available, which I'll be getting into. No, remember when I first said that anything after 4 years, is when we consider to be pathological. But what happens before? We just observe. We just observe to see how the child will develop. But there are different avenues and different ways we can refer the patient based on their problem. For example, if they have a problem with the swallowing, we can then refer them first minimally to a speech pathologist or occupational therapist that will then help them control these muscles. If this is that there's a problem with the alignment of the teeth or any kind of dental concerns, then we can refer them to orthodontist. If it is that there's, for example, let's say an enlarged gland that's just producing all of this saliva, then an ENT surgeon with the person we want to refer them to. There are also medications available, not without their side effects though, but I haven't really seen there recommending children, that's mostly in adults, but there are options available. And if it is that you have seen anything, or there anything I have highlighted that you're kind of concerned with your child and say, maybe I should talk to my GP. Don't be afraid to ask. Okay, guys? No, that's the end of the video. If you have any kind of questions or concern or anything you kind of was wondering about, that's what the comment section is for. Comment and I will look on it, I will research it, and I might just use it for my next video. If you like the video, support your girl, give me a thumbs up. But thanks guys for watching, thanks for staying with me to the end of it, and that's Dr. Brown, and see you next time.